How is CF newborn screening done with IRT? Imagine a tiny blood drop from a newborn's heel, revealing important clues about their health. That's exactly what happens in cystic fibrosis newborn screening using immunoreactive trypsinogen, or IRT. This test is usually done within the first few days after birth, often between 24 to 48 hours. A small prick on the heel collects a few drops of blood onto a special filter paper. This sample is then sent to a laboratory for analysis. The lab measures the level of IRT, which is a protein produced by the pancreas. In babies with cystic fibrosis, the IRT level tends to be higher because the pancreas is often affected by the disease, causing it to release more of this protein. The process starts with the initial IRT measurement. If the level is elevated, it suggests the possibility of cystic fibrosis but is not a definitive diagnosis. Elevated IRT can also occur in premature babies or those who experience stressful delivery, so further testing is needed. Depending on the screening program, there are two common approaches. One is the IRT-DNA method, where a second blood sample is taken after a few weeks, and the IRT level is measured again. If it remains high, genetic testing for common cystic fibrosis gene mutations is performed. The other approach is the IRT-DNA method, where if the first IRT is high, genetic testing is done immediately without waiting for a second IRT test. If the results suggest a high likelihood of cystic fibrosis, additional tests are needed to confirm the diagnosis. The most common confirmatory test is the sweat chloride test, which measures the amount of salt in a person's sweat. High salt levels indicate cystic fibrosis. Genetic testing can also help identify specific mutations in the CFTR gene, which causes the disease. It's important to remember that the IRT test is a screening tool, not a diagnostic test. It can sometimes produce false positives, meaning a baby might test positive but not actually have cystic fibrosis, or false negatives, where a baby with cystic fibrosis might have normal IRT levels. That's why positive screening results always lead to further testing for confirmation. In summary, CF newborn screening with IRT is a simple blood test done shortly after birth that measures a pancreatic protein. Elevated IRT levels prompt additional testing, including genetic analysis and sweat chloride testing, to identify infants who may have cystic fibrosis. This early detection allows for timely treatment and better health outcomes. It's a routine part of newborn screening programs across the United States, although specific procedures can vary by location. Always consult healthcare professionals for personalized advice and follow-up care.